Hello once again. This is my fourth vlog. Um, I hope you all had a Merry Christmas and will have a Happy New Year. But I came to tell you today about the three classes of migraines that there are. The first is a classic. It can be severe pain that's often on one side of the face or head. Um, There are visual auras that cause electrical or chemical charges or waves to move across the brain processes, and visual signs will cause visual hallucinations, um, flashing of lights, zigzag lines, and stars. My symptoms start with a swirling feeling in my head, often with nausea, and then progresses into my left eye or left eyebrow. Cluster headaches are episodic headaches which awaken the patient at night. They're more severe and in and around the eye. Ocular headaches are visual changes that do not cause pain, but may have the flashing lights or the vision, tunnel vision. My husband experiences these when he doesn't get enough sleep. In my first hospitalization, I had an MRI to make sure that there was nothing going on in my head. I wanted to tell you about my second hospitalization. My husband insisted he stay with me because of the bad experience I had with the triple shot, which is 3 medications in one. I had become confused then, and he did not want to see me have that happen again. I had other pain medications that were ordered for every 8 hours, but a half an hour to 45 minutes before that happened, before I was able to get it, I would be crying in pain. I was sent home on Depakote, which is an anti-seizure medication. I would have stomach aches in the hospital, and I attributed them to my gluten intolerance. I figured maybe the dietary wasn't up on gluten intolerance, and that they were probably contaminating my food. Well, when I got home for the first week, I was having stomach pains, and so I called the doctor and had my medication changed. In my third hospitalization, there was one day when there was a fire alarm that went off for 23 minutes. It was a horrible experience. The constant repetitive ringing, I wouldn't be surprised if the rest of the patients there were having problems too. I talked to a few patients while I was there. I talked to a lady who experiences cluster headaches. She was experiencing a very stressful family life, and I felt really bad for her. But she took the time to teach us how to bead jewelry, and I watched her as she tried stringing the beads, and her hand was very shaky. Another patient that I met was from the East Coast. She had episodic headaches, which would be maybe every 3 months she'd get several migraine headaches. And because that they weren't constant or every day, she was having difficulty getting disability for it. But it was really hard for her to work when she had these. While we were there, we also had a psychological assessment to make sure that we weren't suffering from depression. We were offered biofeedback, and I did try it once. I was not impressed with it. We were also offered a walk around campus daily, which was good for those of us who are getting cabin fever. And we were able to go shopping once a day in the gift shop. They also ordered food out, like pizza or Italian food, which was nice, but I never partook of that. Also, they had a beautiful, large, larger than a bay window even, view of Lake Michigan in the sitting room, and I really enjoyed just sitting there and looking at it, watching the boaters, etc. On my day of discharge, a male nurse came into my room very early in the morning and flipped on the floodlights. That immediately threw me into a headache, and I went home with a migraine. I didn't want to stay. I was sick for a whole week after that, and this was during maple season, where I make maple syrup I cook down the sap. I was so sick with nausea, headaches, and bladder spasms that I nearly had my husband go and throw out the sap so I wouldn't have to do it. During a period of time with particularly bad migraine, I had my son take down the wind chimes because the noise bothered me so badly. I can't stand bright blinking lights and probably won't ever be able to go to a large production or a concert. The social disabilities are that I miss church, and I had to quit playing organ because I couldn't be there regularly. I ended up with a migraine when I was driving to a friend's funeral and had to turn around and go back. I've missed a couple of retirement parties for coworkers that I had, and I had to change plans to go and visit friends. On my next vlog, I will discuss my 4th hospitalization and backtrack to my retirement due to my disability. Thank you for listening. Please hit the like button if you enjoyed this, and subscribe if you would like to receive further notifications. Thank you once again, and goodbye for now.